Blood pressure is the force per unit area exerted on a vessel wall by the contained blood. The normal blood pressure for a healthy adult is 120 over 80 millimeters of mercury, with a normal systolic pressure being below 120 millimeters of mercury, and a normal diastolic pressure being below 80 millimeters of mercury. Systolic pressure refers to the blood pressure within the artery when it is maximally stretched during ventricular contraction. It is important to regularly check blood pressure to know if you have high blood pressure, as there are usually no signs or symptoms of having high blood pressure. High blood pressure could also be a symptom of other conditions such as diabetes or kidney problems. We will begin by going over the equipment required to record blood pressure. First, we have the stethoscope. The stethoscope has the chest piece, the ear tubes, and the ear tips. Okay, the chest piece has the diaphragm and the bell. The diaphragm records higher pitch sounds and the bell records lower pitch sounds. If you'd like to switch from the diaphragm to the bell, you just have to twist it. Then we have the ear tips. So the ear tips go inside your ears. Make sure that they are facing away from you when inserting them inside.
The other piece of equipment that we use to measure blood pressure is the sphygmomanometer, and so the first part of it is this cuff. The cuff itself, it'll go on the upper portion of the arm over the antecubital area, and the cuff will have a little line to indicate where to put it over the artery here, so you want to make sure it lines up there when you're putting it on. Then below the cuff we have the manometer itself, which is, it takes the measurement of the blood pressure in millimeters of mercury. And then on the other side we have the little bulb. You use it to inflate the cuff, so if you turn it to the right, it closes it. You won't be able to pump any air in or lose any air. And then when you turn it to the left, you can release the air from the cuff. Hi Julia, I'm going to be your doctor for today. Is it okay if I really quickly get your blood pressure?
Of course.
Perfect. Give me 1 second, just sanitize my hands, okay? Alright, so for the blood pressure cuff, what I'm going to end up doing is I'm going to be putting it on your upper arm. So could you roll up your sleeve for me a little bit? Just because the best way to get blood pressure is to make sure that the cuff is directly on the skin. Now if I could have you just turn your arm out, perfect. Now on the blood pressure cuff, if you can see right here, it shows exactly where I need to line this up. So your artery, I'm going to first feel for a pulse using my 2 fingers, just because that way I can get a good feel for it and make sure that the cuff is placed on correctly. Alright, perfect. With my stethoscope, when I put it on, I'm going to be able to hear everything perfectly, okay? I'm going to tap it really lightly just to make sure this thing is on. There we go. And I'm going to end up putting it exactly right where your artery is, right under there. And when I hold this down, I'm going to be using my 2 fingers because with my thumb it has a pulse. Otherwise, I'm going to mix it up with the other one, okay? So, I'm going to ask if you could actually hold this for me. Perfect. So now what I'm going to do is I'm going to turn this to the left side and pump some air into the cuff. Once it gets up to 180, between 180 and 200, that's when I'm gonna stop pumping and slowly begin to let the air out. Because once it gets to 180, 200, at that point, I've cut off the artery, no blood is gonna be coming down, okay? So give me 1 second just to pump this. Now I'm going to slowly release, and when I hear the first sound of the blood rushing back down into your arm, I'm going to record that, okay? Right there. I heard it right there around 138, so it is a little bit higher, but that could be from anxiety. And I can hear it pumping very well, and I'm going to also mark the spot when I no longer hear the thumping sound. So the last spot I heard your blood pumping at was 70. So your blood pressure is 138 over 70, okay?
There are many ways to maintain a healthy blood pressure. It is important to be physically active because it can help you maintain a healthy weight and blood pressure and avoid obesity. Try to exercise at least 2 hours and 30 minutes every week at a moderate intensity. You should also avoid smoking because it can lead to high blood pressure and increase the risk of heart disease. If you smoke, talk to a health professional on ways to quit smoking. Limit alcohol intake to 2 drinks a day for men and 1 drink a day for women. Alcohol can also increase your blood pressure. A healthy diet that is rich in fruits, vegetables, proteins, fibers, and potassium, and low in sodium and saturated fats can also greatly decrease the risk of high blood pressure.